Getting every stage of life right matters. And that includes end-of-life care, or what we call palliative care. And I don't think patients or families are prepared for how difficult, but also how meaningful this time can be. Now, I learned this the hard way. We lost my wife's mom during medical school in this formative time of our training. And I've learned how meaningful it can be from incredible mentors in palliative care, in a hospice setting, in geriatric medicine, in old age psychiatry, in hospital and community settings throughout my nearly decade-long career. So I'm Dr. Matthew Glaudeman. In this video, I want to share with you a few things I wish patients and families knew about this really critical and important moment in life. First thing, call as often as you need to. I emphasize this to any patient or family who's in an end-of-life stage, that you shouldn't have to try and navigate this alone. It is hard enough. I mean, from personal experience, we were in medical school learning about neurology with my wife's mom having a brain tumor. You're trying to spin a bunch of different plates. You're trying to navigate treatments, investigations, care, and your own family life. Maybe you got a young children, maybe you're working your job, maybe you're trying to coordinate with different family members across an entire country or continent or wherever. So call as often as you need to. That's such a critical part of this. Second thing you need to know is that a suffering patient in the community is my top priority as a community doctor. So if it's in or out of hours, we're trying to rapidly respond to these people. So if you're in pain, if you're agitated, if you're struggling with nausea, vomiting, secretions, any of these things, we're trying to support you quickly. So you may not need an ambulance going to the hospital, but you do need urgent emergency help to support you. Now, this is the other question I learned is a critical one from a mentor in a hospice setting. And it literally changes what we might do as doctors. The question is, would you rather be comfortable but sedated, or would you rather be more alert but needing to ask for medication? And there's no wrong answer here. Some patients would prefer to be more comfortable and a bit drowsy if that's the side effect from that medication. And it changes what medication we pick for those patients. Some people would rather be alert, maybe struggling a little bit with symptoms, but being able to communicate and talk to their family. And that can change throughout time as well. So it's a critical question to ask. It's something I learned, and now I ask to any patient or family member I'm encountering in this stage of life. Second thing is that everybody has a line between tests, investigations, treatments. We as doctors are good at giving hope or alternatives or options. And some people are happy to pursue those options and continue to pursue them. Some people shift from test, investigation, treatment to actually, you know what, at this stage, I'd rather be kept comfortable. I'd rather spend meaningful time with my family or friends. And again, there's no wrong answer there. So it's important to think about that and decide what line is for you, what line might be for your family member. The other thing, if your family member can't make that decision, it's important to ask them ahead of time if you can, or what I say to patients and families, if let's say someone has dementia, is like, you know your mom, dad, brother, sister better than I ever will. What do you think they would want at this stage? And that helps guide us into the right answer, or the best answer we can come up with. But again, there's no wrong answer here. I think patients and families sometimes feel pressured that they're going to make a mistake or make an error. It's trying to navigate something that's very difficult. And you know, when we were training doctors, we didn't know how to navigate. I can't imagine how difficult that is for patients and families to try and navigate who have limited or no medical experience. Even now, like, I have this rare blend of clinical experience across so many different specialties. That's not common, but it helps me guide patients and families in a way. And part of the reason why I'm making this video is so that I can help you guide this difficult journey. The other thing is that the little things matter. One of the things that they said to me the first day, I think, at the hospice that I worked at, was 1% of what we did was the medication. And I found out how true that was throughout my 6 months in the hospice. It was all the little things. It was playing music that they liked. It was talking to them, holding hands. Maybe it was, having the conversations, the difficult ones that you put off for a number of years, and reconciling with family members. It was humor. Like, you think it's like doom and gloom in a hospice. I think a lot of people think that way. It absolutely wasn't. It was more joyous, meaningful moments. That's why hospices are so important. They used to tease me because I'm pretty tall, and they used to like lean in and whisper to the patients. And I didn't realize why until months later, when I was like, I was reflecting on some of my career moments when I was writing a book, and I realized I was doing that with my wife's mom. She couldn't communicate, but she could still hear, and she would squeeze your hand. So there's like these meaningful moments that you want to take from that. And you can't always control the outcome, but you can change the experience for that person, but also for the family and friends that carry the memories on. So I hope this video helps you.